The temperature is dropping, and as more people gather indoors, there's always the risk of another COVID surge. Many people are also now eligible for the new bivalent booster shot. With all of that in mind, we've invited Dr. Janet DeMille to join us to talk about what's top of mind for her. She's the Medical Officer of Health for the Thunder Bay District. Dr. DeMille, good morning.
Good morning, Mary Jane.
So, winter on the way. We know there are concerns about COVID case numbers rising, and we're also hearing about already understaffed hospitals struggling, as well as flu season. What's your top concern right now?
It's hard to put one concern. I think you've already mentioned a couple of things that are really top of mind for me, and I think it's just the real confluence of things coming together, right? It's winter. We're inside. We're going to be inside for a while, right? We won't have the benefit of being able to be outside like we had over the summer. We are seeing increasing numbers of more spread of COVID. We never really went down to a low point after the last wave, the BA5 wave we had back in the beginning of August. We didn't go down to a low baseline like we have done in the past, and that has to do with just people going inside and the fall coming. So we're already starting at that higher baseline, and we're expecting, more sublineages of new variants, of subvariants really coming our way. And I know that even as soon as the month of November, we could be seeing another one here in the Thunder Bay area, Thunder Bay District, replacing BA5, and we're starting to see even some increasing number of flu cases. So it's going to be that confluence. And of course, you mentioned healthcare. That's a big concern. Is the healthcare system is already under significant pressure, and both flu and COVID, among other respiratory viruses that spread, are really going to cause a problem. I think I would frame it, though, other ways. Maybe we'll talk about this in terms of the boosters, but I am concerned that there are a lot of people right now that aren't effectively protected. The big way of getting that protection right now, especially for those at high risk, are with that bivalent booster.
And given all of that the added risk, as you mentioned, with more people gathering inside, how comfortable are you with the level of masking in public right now? It's fairly low, isn't it? I do see some people wearing a mask, and I really appreciate that. And I would certainly encourage people who are at high risk to be wearing a well-fitted mask right now to help protect themselves. As always, I've always encouraged other people, if you're in especially in an indoor closed space, to wear a mask. That would help reduce the spread of these viruses, especially if there was a high number of people to do it. I do want to actually get it out there, though, that if you do have COVID, or if you do have COVID symptoms, even if you don't know if it's COVID, it could be flu, for example, please wear a mask. You should be wearing a mask for up to that 10-day period after your symptoms start. And for people who have been exposed to somebody with COVID, or with somebody with COVID symptoms, they should be wearing a mask. I say that because those are the people who are most likely to have COVID. Even if they have no symptoms, they could be there. So, those individuals, just a reminder to them to please wear a mask. Now, we recently spoke with the head of the Northwestern Health Unit. She's encouraging people to get their vaccinations updated as soon as possible this fall, partly because of fears that a surge will overwhelm health systems, but also because she says her health unit staff just want to get back to doing their normal jobs, addressing other health concerns that they can't do when they're spending so much time on COVID. How relatable is that to you?
Oh, very much. This pandemic, both the managing of COVID and the cases and outbreaks, but also the vaccine rollout has been huge in terms of the impact that it's had on public health. I think we've really
very much tried to put in place a sustainable way of managing both our COVID response, but also our regular programming and being able to do that. And we're fortunate that we have received sort of extra funding for that. I know, it's really, needing a lot of staff, and that can be challenging, especially in smaller areas to recruit the needed. They're often health professionals, and we know that that's really stretched. So we have been, as much as possible, trying to do our regular programming. We're, for example, doing a lot of the school immunization right now. Other programming is running, but certainly I am concerned as we get into the fall and a surge and more outbreaks that we will be stretched, and certainly we do have a lot of other programming that we would like to continue.
Do you have any particular concerns about programs that maybe need more attention and aren't getting it?
It's all probably all of them I would have a concern for, but we're seeing, other infectious diseases, of course, that we have to follow up on, and we're, as much as possible, have maintained that. Of course, opioids and the harms due to opioid overdose. We do a lot of work with that already, but there's certainly more that could be done. We have a whole health protection division, which is really about supporting health and well-being and prevention of issues in chronic disease, for example, and the hazards of smoking and vaping and such, and alcohol. We know alcohol consumption has gone up with the pandemic, and we already had really high rates. And so these are all other things that are impacting, and those programs are very important too. So can't necessarily pick one or two sort of items that are top of mind, but all of them are really
impacted in some way.
Yeah.
Now, for the fourth dose of the vaccine, uptake in our district is quite low, I understand, for younger demographics under 60. Why is this booster so important?
So I would say the booster is most important to protect people that are at highest risk. So when we talk about COVID, that's generally considered people over the age of 70, and we know that as well as people who are immunocompromised, who may not respond as well, people who have underlying health problems that may not, it can be complicated when they had COVID and lead to more serious consequences. And certainly when we talk about protecting the healthcare system, we really, ideally want to prevent people from requiring hospitalization or even hospital support. So, and we're seeing a sort of uptake in the 70 years of age and older, although I hope to see more coming in. I really want to put a call out there for people who are 60 and 69. I think that's the next age group that I'm concerned about, and that number is still fairly low. When I think of a younger population, COVID is generally milder, not always. People do recover. However, I am concerned about things like long COVID, right? And the best way to avoid long COVID is to not get COVID. And the booster now would really, provide some protection against that. It's not perfect, of course, but it would provide that. And I think we need to talk more about long COVID and the impacts that it has on people, and how it really impacts people's, lives and ability to kind of, go to work, to parent when they have a bad case of long COVID.
And speaking of long COVID, I was just recently speaking to Dr. Lynn about this, and a new StatsCan report showing almost 15% of Canadian adults who had COVID reported those ongoing COVID symptoms at least 3 months after their infection. Yeah. How worried are you about long-term effects on people here?
Oh, absolutely. I think it's, we get, we certainly understand the severe, people who have to, have COVID and they need hospitalization or ICU or pass away.
But I think that people who have long COVID, it can often be very hidden, right? If people might be young, they might be, healthy in general, they look okay, they don't require hospitalization, but they can be really experiencing a significant impact on their lives. And I think even Dr. Lynn sort of noted, there are some people have milder symptoms even of long COVID. It's just that they're prolonged. There are some people that have more substantial symptoms that impact their lives. And I think, they're not necessarily seen. They're often, at home. They're unable to do certain things. Perhaps they're unable to, to do what they want in terms of parenting their kids. They're having this impact. And I think that's going to have, because it can last a long time as well, up to a year. I think a lot of people might recover after a year, but even past 1 year, they have that. And, when we continue to see COVID spreading in our community and people may not, when we're not necessarily doing all of those public health measures as well as we could, like vaccine and masking, for example, then, we're going to continue to see people experiencing longer COVID.
Dr. DeMille, before I let you go, is there anything else you want people to know? I just invite people about the flu shot, right? It's still important there. And right now in the month of October, where the focus is on those at high risk. It's 65 plus, people who are pregnant, people who have underlying health problems. Certainly would like to see a really good uptake of flu as well. We are starting to see some sporadic cases, but they're getting more and more frequent, those cases. So we're experiencing an earlier, starting to see that earlier. And of course that will combine with COVID. And for the general public, in November, they'll be eligible to get their flu shot. And it's okay to get your flu shot at the same time as your COVID shot. Good to know. Thanks so much.
Thank you very much, Mary Jane.
Dr. Janet DeMille is Thunder Bay's Medical Officer of Health.